Good afternoon to one and all. Hearty welcome to RHS 2020. I am happy to announce that in spite of this COVID situation, Railway chapter of anesthesiologists could manage to organize this 26th RHS 2020 in Calcutta. So in this conjuncture, the role of our anesthesiologists of Railway chapter is vast. Though this chapter started this organizing this conference for knowledge sharing from 1995 from Gorakhpur, and now it has come to establish its significant role in upgrading of effectiveness and efficiency of Indian Railway health services in each and every aspect of following aspects in Indian Railways. Most important is in railway services, railway medical services, their academic activities, their research programs, and social and public awareness activities. So the role of anesthesiology services has extended outside traditional operation theatres long ago. Now anesthesiologists are important service providers in ICU, in CCU, in emergency rooms too, as well as interventional suites, labor rooms, pain clinics, and so on and so forth. Adding much more to the demand for services from the field of anesthesiology arrived this corona pandemic. Our railway anesthesiologists swiftly responded to the global challenge more scientifically and rationally, using their time-tested, reliable dedications to their patient care and commitment to the safety, health and well-being of our railway beneficiaries. We have established dedicated corona health facilities for all categories of patients' care all over Indian Railway healthcare facilities since the announcement of the pandemic and lockdown conditions started since March 2020. Our statistics shows that our cure rate in railway establishments is much more in comparison to outside health agencies. We have been able to provide COVID beds efficiently and cure COVID patients well, though death rates are also to name around 7 to 8% all over Indian Railway hospital care systems. But at the same time, after intervention of ICU ventilators, HFNOs and liquid medical oxygen system installed, so death rates has drastically come down. At the same time, special coaches have been converted to COVID care centers and for quarantine centers. Otherwise, we have been able to provide also help to migration workers to go back to their native place. Now, considering the mortality and morbidity statistics of railway doctors and medical and health paramedical staffs, it's very unfortunate that while treatment of our COVID patients, our doctors are getting infected and 3 important lives have been lost in the last 7 months. RAISA members, I congratulate Dr. Kamakshi Selvam, Dr. C.K. Patel, Dr. D.K. Sahu. They have published special articles indexed in Indian Journal of Anesthesiology and Indian Railway COVID-19 Management Systems, highlighting the prompt and professional approach of Indian Railway health systems in any unforeseen health emergencies of any magnitude. At the same time, RAISA have successfully conducted their past 25th annual national conference with grand success, fulfilling the aims and objectives with which the association have begun their journey. This year, despite COVID-19 pandemic demands, railway anesthesiologists have participated nationally and globally in a big way through ISA in the World Anesthesia Day celebrations on 16th October 2020 and rightly projected Indian Railway Health Services contributions towards the control of and management of COVID-19 pandemics, and at the same time providing adequate and effective services of non-COVID-19 healthcare services to our beneficiaries. Now RAISA is conducting their 26th annual national conference as a web conference amidst this COVID-19 pandemic to share experience and expertise to disseminate the proven, safe and scientific skill and knowledge in the most effective, economic and efficient manner. The theme of this conference is COVID-19 pandemic challenges for railway anesthesia services. So I feel this is a timely and relevant effort by the RHS, which is well focused and well directed for the need of the hour. I wish all success for the smooth conducting of this RHS WebCon 2020. Thanks to the organizer for inviting me as a chief guest for the RHSACON 2020. Thank you all. Goodbye.